social innovation, at one time very easy to define. Today slightly murkier grounds because we don't really know, myths abound, roles aren't very, very clear. It can be political talk for just political gain. And we live in a crisis-a-minute world where new age problems are now mixing with old classic problems we haven't solved as yet. Into this new thinking, the need for new thinking is stark and very required. I think that's what's going to happen today. This murkier world may become a little bit clearer, and the start to new thinking may well start from this panel and the rest of the day. So let me first introduce the panel to you. It's a super panel, and that's what will really set the stage for the rest of the day. I'm going to start from my immediate left, Mr. Pramod Bhasin, Chairman, the Skills Academy, Non-Executive Vice Chairman and former President and CEO of Genpact. Right next to him, Mr. Sunil Wadhwani, founding donor, Wadhwani Initiative for Sustainable Healthcare. Right next to him is Mr. Niranjan Hiranandani, co-founder and MD Hiranandani Developers. And of course, right at the other edge is Ms. Isher Judge Ahluwalia, Indian Economist, Chairperson, Board of Governors, Indian Council for Research on International Economic Relations. Thank you very much. I'm going to start off with finding out from you the challenges that are about social innovation. We can define it today any which way we like, but the challenges that abound, and where do you think the solution will come from? I'll start with you.
For me, the biggest challenges are around scalability. So we have an enormous amount of social innovation happening in this country. There are countless examples of great work being done in pockets in different states by different institutions. But how do we bring it together? And how do we make it really impactful at a scalable size, given the size of our nation? Let me just take an example of skills. With all the discussion that is happening, we have a remarkable problem. We have the world's youngest demographic grouping, unskilled, and we have on the other side industry which is constantly worried about the fact that they can't get skilled labor to come and make them more productive. Our productivity of an Indian worker today is 15% of that of a US worker today. Okay. So this huge mismatch, this huge contradiction has to be solved, but it has to be solved at speed. Right now there's, I would imagine there are hundreds of organizations doing 5,000, 2,000, 10,000 people, but we all collectively need to train. There's 1 million people joining the workforce every month. We need to train effectively 12 to 14 million people in new skills which make them far more employable and which aid India's competitiveness.
That's a staggering number. So while on stage we've thrown a number like that out, that's a huge number. If it hasn't happened before, then where's the solution to do it now?
Speed matters. You have to implement projects in time. You have to get stuff done. You have to achieve last mile solutions in time. So there are solutions coming up, and which I get excited about. So broadband is coming in, but make broadband at the last mile connectivity free. Many countries have done that. Broadband is a highway. It builds industry all around it. And if we could reach thousands and hundreds of thousands of people, because that's what we need to do.
Okay, great. So I'm going to come back to you for a real action plan. I'm going to start off with the same question to you. Real challenges right now, and where will the solution come from?
Well, I'll tell you what, I agree completely with Pramod. There's a lot of social innovation happening. Big companies are doing it, smaller social innovators are doing it, governments even are innovating, state governments in our country. To me, the challenge is fragmentation. There are a lot, whatever sector you think of, education, healthcare, livelihoods, agriculture, a lot of very good, well-meaning efforts, but each one is operating in isolation. Okay. There's very little working together, there's very little synergy, so the big problems are still there. So let me give you an example. I've been supporting various NGOs in the healthcare space in India for the last 10 or 15 years, and recently I've started my own. So I go out to remote parts of the country, and about 3 or 4 years ago I happened to be going out into Rajasthan. I met a lady, this is in the rural areas, very poor lady, farmer and wife, Parvati Devi, who was starting to have bad backaches, etc., etc. She went to her local vet, got some golies, nothing happened. Went to her local Asha worker, got some more golies, nothing happened. Finally had to go to the primary health clinic, doctor wasn't there. She and her husband lost a day's worth of wages by going there and coming back. Finally, she got to see a doctor on the 3rd visit, and the doctor says, not quite sure about your symptoms, now you have to go to the district hospital, get a test done, it's going to cost you 350 rupees. She decided she couldn't afford it, didn't go to the district hospital, ended up with very severe diabetes, and that poor family, which previously had 2 wage earners, now had only 1 wage earner. Okay? Now, fast forward to 2 months ago. I'm sitting here in Delhi with a small group of graduates, 3 or 4 graduates, who've developed this really interesting glucometer for measuring blood sugar levels for 5 rupees a test. Dramatically lower than the cost before this. So I'm sitting here thinking, if this were widely available, if ASHA workers were trained up on how to administer this, think of how many lives would be improved, like this lady Parvati Devi. Think of the scale we could have. So as an example, with my new NGO that I formed called WISH, W-I-S-H, we've started working with the state governments of the low income, high priority states in northern India, Rajasthan, Madhya Pradesh and so on, identifying the most promising innovations and then helping them scale up. And a big part of our scale up is bringing the players together, including government, NGOs, corporates, and we are starting to see some very good results.
Sure. You represent the infrastructure part of it, I mean, more or less, right? Do you see that to be one of the areas where the greatest challenges lie, and could there be a solution from there, or is that a completely different game?
I think in the last 10 years, we haven't seen any infrastructure development whatsoever. So we have a backlog of 10 to 15 years to first catch up on. In the housing sector, we have only 35 years to catch up on. For instance, Mumbai has 50% of the people living in Jhopatpattis with transport, communications, etc., almost devoid of reality. So I think on all these sectors, innovation is needed fast, as Pramod has correctly put it. But more than that, there is a big problem. We know what to do. The master plans are there. The governments talk about it. The chief ministers announce it. The foundation stone ceremonies are done. We announce it in the papers as manifestos. But walking the talk, zero. So we need social innovation to actually actualize at the operational level, and those people who have learnt to go up the ladder because they did not perform, because they were corrupt, those are the type of people which need change most. How do you get those people to change? That's the biggest challenge.
Ma'am, the stage is now all yours. The real challenges, the real issues, and where you see the solution will come from.
You know, I am actually very hopeful because about 10-15 years ago, if you wanted to look for inspiration, you had to look at examples in other countries. What I have found in the last 6 to 7 years, when I have traveled extensively in urban India, is that we have numerous examples of social innovation leading to better service delivery in cities, and I am going to give you 3 or 4 examples. Pammal is a small town in which a group of women, a small town in Tamil Nadu, a group of women started the task of solid waste management. They first started by collecting the garbage, segregating it at source, making compost in a very small way. And then it was corporate sector that stepped forward, that saw what they were doing, gave them more working capital, and also helped them buy some equipment, and they were able to cover the whole town. So this is one small town in India which is actually doing solid waste management, which is a critical part of Swachh Bharat.
Okay.
Now, let me give you another example. We keep talking about unsafe drinking water, scarce drinking water. Now, Nandi is an NGO set up by Dr. Anji Reddy 15 years ago, and then other corporates have come to become members. I had the proud privilege to be a member of Nandi. Today, we have close to 400 reverse osmosis plants in rural India, where Nandi engages with panchayats. They identify a source of water, and then they say, okay, you clean that water for us, and that water is then sold at minimal prices so that you can look after operation and maintenance of these plants. Now this is an innovative idea. Why can we not scale it up? What we need to do is to really replicate them, adapt them, and in my view, the critical factors are leadership by the state government, use of new technology, human leadership, which is critical, and what you said, changing of mindsets. We just have to learn to do things differently, and I think there's enormous possibility. It should not be seen, this whole social innovation initiative should not be seen as filling the budgetary gaps where government does not have money. So corporate sector says we come forth and we give you money. It has to do with institutional reform, better trust between government and the private sector, and basically creating a new environment in which citizens demand better governance and the government is then forced to be accountable.